Let's start our journey to crack AIAPGET by solving this year's question paper. This will help you to understand the nature of the questions asked and their level of toughness. In this video, we will glance through the questions briefly and we will further study the topics in detail in our upcoming videos. Question number 1. Stelvig sign is related to. Now what is Stelvig sign? It is basically an infrequent or incomplete blinking of eye associated with Graves' orbitopathy, which is a symptom of primary toxic goiter. Hence, the correct option is option B. Question number 2. Tendo Achilles is mentioned in which of the following section of therapeutic pocket book? Tendo Achilles or the Achilles tendon is the thickest tendon present at the back of lower leg in human body. So the correct option is option A, lower extremities. Question number 3. Which of the following makes medial boundary of femoral ring? Now before answering this question, let's have a quick brief about femoral ring and its boundaries. Femoral ring is bounded anteriorly by inguinal ligament, posteriorly by iliopectineal ligament, and medially by lacunar ligament. Hence, the correct option is option B, lacunar ligament. Question number 4. This question is about description of a vector. There are small bilaterally compressed wingless insects with hard chitinous exoskeleton and covered with backwardly directed strong bristles. These are the features of which vector? So the correct option is option B, fleas. Question number 5. Match list 1 with list 2. Now what is one-sided disease? It is displaying one or two principal symptoms which obscure almost all other. What are local maladies? It is changes appearing on external part of the body but not confined to that part only. What is alternating disease? Certain diseases alternating at uncertain level. And what are intermittent disease? It is disease of varying character returning at a fixed point or interval or period. So the correct option is option 3. Question number 6. What is the disadvantage of external application of homeopathy medicine along with internal dose of medicine as given in 5th edition of Organon of Medicine? Now according to aphorism 191 of Organon, it is said that local symptoms will disappear sooner than the internal disease. So the correct option is option B. Question number 7. Vital force creates local affection in chronic disease. Now, according to aphorism 201 of 5th edition, it is said that vital force creates local affection in a chronic disease to silence the internal disease for some time. So, the correct option is option C. Question number 8. Identify the medicine for the following symptoms. Patient is debilitated. Debility is a symptom of acidic group. So, to rule out everything, we can have sulfuric acid as an option. But let's complete the question and then we'll answer. Concussion of brain where skin is cold, body bathed with cold sweat, and also craving for alcohol. So, the correct option here is sulfuric acidum. Question number 9. Which of the following repertory in which abdomen is mentioned as the first chapter? Now since you know, a concise repertory of homeopathic medicine by H.R. Phatak is an alphabetical repertory. So, abdomen is mentioned as its first chapter. So the correct option is option 4. Question number 10. Lymph capillaries are absent in all except. Now what is lymph capillaries? Lymph capillaries are tiny vessels found in tissue of most organs. They transport and filter the lymph from the body, cells and tissues and keep consistent blood pressure. So in skin, lymph capillaries are found in dermis layer. So the correct option is option 2. Question number 11. Pulsatile liver can be seen in. Now pulsatile liver sign or the Rosenbeck sign is seen as a sign of secondary tricuspid regurgitation. So the correct option is option 3. Question number 12. According to J.T. Kent, too short relief of symptoms in acute disease is because of. Now you know that J.T. Kent has given 12 observations, and among those 12 observations, the 6th observation is about too short relief of symptom. It has 2 parts, one which mentions about the acute disease, the second part mentions about the chronic disease. Now according to J.T. Kent, in acute disease, very high grade inflammatory action or the organ affected thereby is threatened in case of too short relief of a symptom. So the correct option is option 2. Question number 13. The advice avoid to take milk should be given to patient while prescribing in which among of the following medicines? Now, according to Dr. Bonninghausen, milk should be avoided while taking bromine. So, the correct option is option 2. Question number 14. Match list 1 with list 2. Now, pulsatilla has sweet saliva, nitric acid has bloody saliva, ignitia has a sour saliva, and calibicromatum has a viscid saliva. So the correct option for this question is option number 4. Question number 15. The most common cause of female infertility is the ovulatory dysfunction. Question number 16. Lanolin has following properties. Now what is lanolin? It is a translucent, yellowish, white, soft, tenacious substance which is readily absorbed by skin, which makes it an ideal base for any medicinal product. Its melting point is between 36 to 42 degrees Celsius. It contains not more than 0.25% of water and it is freely soluble in solvent ether and chloroform. So the correct option is option 2. Question number 17. The most prolific source of all innumerable named or unnamed chronic maladies under which mankind groans is. It is option number 4, external mode of treatment. Question number 18. Which of the following statements are correct? So the correct option here is option 1, that is, chalazion is a chronic granulomatous inflammation of a meibomian gland. D. Acute angle closure glaucoma usually occurs in older, often hypermetropic patients. And E. Blood in the interior chamber of eye is called hyphema. Question number 19. A patient of epilepsy presented with sudden loss of postural muscle tone lasting 1 to 2 seconds. There was brief impairment of consciousness but no post-ictal confusion. The most likely diagnosis is. Now the correct option is option 3, a tonic seizure. Let's talk about a tonic seizure. It is type of seizure that cause sudden loss of muscle strength, causing the person to fall on the ground. Question number 20. Match list 1 with list 2. The correct option here is option number 3, which is Curie is related to becquerel, Roentgen is related to coulomb per kilogram, Rad is related to Gray, and Rem is related to Sievert. Question number 21. Commonest position in vertex presentation is? It is LOA, which is left occipito-anterior position. Question number 22. In context to generalities section of Kent's repertory, which of the following rubric is given for when too much medicine has produced an oversensitive state and remedies fail to act? The correct option is option 4, irritability. Question number 23. Alternating diseases are chronic diseases caused by. Now this statement has been given in aphorism number 232. It states that alternating diseases are chronic diseases caused by sora alone or sometime complicated with syphilitic miasm. Question number 24. Subarachnoid space extend up to lower border of which vertebra? The spinal subarachnoid space begins at foramen magnum and extends to terminate at the level of S2 vertebra, that is the second sacral vertebra. Question number 25. The second most abundant anions in extracellular fluid are? Now everybody knows that the most abundant anions are the chloride ions and the second most abundant anions are the bicarbonate anions. Hence, the correct option is option 1, bicarbonate anions. Question number 26. Given below are two statements, one is labeled as assertion and the other is labeled as reason. Here, the correct option is option 1, that is both A and R are correct and R is the correct explanation of A. Now let's read the assertion and then read the reason. The conversion of spermatids to sperms will not occur without FSH stimulation of the Sertoli cells. And why so? It is because that follicle stimulating hormone, also secreted by anterior pituitary gland, stimulates Sertoli cells. Question number 27. The apparent symptom caused by excess of homeopathic medicine will soon disappear when medicine is discontinued is called. Now, this statement has been mentioned in aphorism number 248. It states that the apparent symptom caused by excess of homeopathic medicine will soon disappear when medicine is discontinued. This is known as Sheen symptom. Question number 28. Which of the following rubric from BBC is not given in the mind section of Kent's repertory? The correct option is option 3, passionate. Question number 29. The range of firing at which there is no burning, blackening or tattooing except producing a round hole 4 or 5 cm in diameter for all gauges and all chokes lies between 1 to 2 meters. Now this question is from FMT. Question number 30. Torsion of ovary most commonly seen in? Now this has a reason. Torsion occurs in 15% of dermoid cysts as a result of their high fat content, causing them to freely float in the abdominal cavity. Hence, the correct option is option 2, dermoid cyst. Thank you for watching.